Here are 3 habits silently damaging your teeth. But first, let me tell you something that might completely change the way you think about dental health. So, every day, millions of people wake up, brush in the morning, brush at night, use a floss, use a mouthwash, and they think they're doing everything right. But while they're focused on these obvious habits, there are silent things that are working 24/7 to undermine everything and all the good they're doing. So then, after years of hidden damage, they sit in the dentist's chair wondering how all of a sudden they need root canals, crowns, extractions, and therefore, understanding these habits isn't just about prevention. So, starting with number one, and that's mouth breathing. So, right now, as you're watching this, you're probably breathing through your nose. It feels natural, it feels automatic, but the moment you fall asleep, there's a good chance that this breathing pattern will completely change without you even knowing it. So, in the next 7 to 8 hours while you're sleeping, your mouth will transform from a protected, healing environment to a breeding ground for the exact bacteria that destroy your teeth. And therefore, you could be undoing all the good work that you do when you brush and you floss at night, and you don't even know it's happening. And let me tell you something most people don't know about saliva. So every day you produce about 1.5 liters worth of saliva, and that's about 3 bottles worth of saliva. But the crazy part is it's not just for your digestion. So your saliva is like a liquid pharmacy. It's packed with antimicrobial proteins, minerals for tooth repair, and pH buffers that neutralize acid attacks. But when you mouth breathe, especially during sleep, your saliva production doesn't just decrease, it crashes by up to 90%. And then your mouth's pH plummets from a protective 7.0 to a dangerous 5.5 or even lower. And therefore, the bacteria that cause cavities and gum disease all of a sudden have that perfect acidic, dry environment to multiply exponentially. And here's the thing. Mouth breathing doesn't just cause cavities. It can actually change the shape of your face over time, and I'll explain how and why in just a moment. But first, picture this. So, your mouth contains about 6 billion bacteria, and that might sound like a lot, but most of them are actually protective when your saliva is keeping everything balanced. And when you mouth breathe all night, the harmful bacteria can multiply by up to 10 times or even more, particularly the one that's called Streptococcus mutans, and that's the main culprit behind cavities, and that thrives in dry, acidic conditions. And these bacteria don't just sit there. They form organized communities called biofilms, essentially building protective cities on your teeth where they can produce acid continuously. And your dried out mouth can't wash them away, and it can't neutralize their acid, and it can't deliver the minerals needed to repair the early microscopic damage they're causing. Now, about that face changing claim, which is going to sound like science fiction, but is completely real. When children consistently mouth breathe, it affects the development of their facial bones. But as the jaw grows longer and narrower, the palate, which is basically the roof of the mouth, becomes higher and more constricted. And the face then ends up having what researchers call a long face syndrome. And this creates even more breathing problems, making mouth breathing even worse as they become adults. And therefore, mouth breathing becomes like a vicious cycle that gets passed on through generations, with each generation having worse breathing and more dental problems, and so on and so forth. And even in adults, chronic mouth breathing can actually change the facial muscle tone and can contribute to premature aging, especially around the mouth area. And that constant drying effect can make the lips thinner. Now, here's the tricky part. Most mouth breathing happens during sleep. So you might not even know that you're doing it, but there are telltale signs that we look out for. For example, do you wake up with a dry mouth or a bad breath that brushing doesn't fix? Or do you have a sore throat in the morning? Or do you snore? Or has anyone ever told you you sleep with your mouth open? Or even during the day, do you catch yourself mouth breathing, especially when you're concentrating? Or do you have a chronic nasal congestion? Or do you breathe through your mouth while exercising? Because all of these can be red flag. But here's what most people get wrong. They try to force themselves to breathe through their nose without addressing why they're mouth breathing in the first place. And then they get frustrated when it doesn't work, especially at night, and why they can't consciously control it. And the culprits here are usually chronic allergies that cause nasal congestion, a deviated septum, enlarged tonsils or adenoids, or a tongue tie or poor tongue posture, sleep apnea, or even the shape of your jaw or your palate, the roof of your mouth. And sometimes it's as simple as chronic inflammation from environmental allergens. And the solution here starts with clearing the path. So use saline rinses to reduce inflammation and clear mucus, or even address the allergies with proper treatment, and don't just accept chronic congestion as normal. And even consider seeing an ENT doctor if you have structural issues. And for immediate relief, try sleeping with your head slightly elevated, or use a humidifier to keep the air moist in the room, and even proper tongue posture during the day. So the tongue should rest on the roof of your mouth and not the floor. And habit number 2 is sipping acidic drinks. So many drinks that we think are healthy, for example, green tea, kombucha, sparkling water still expose your teeth to acid. And over time, that constant exposure erodes the enamel. It can lead to sensitivity, and that can lead to cavities, even if you're brushing and flossing properly. Now, every sip of an acidic drink drops the pH of your mouth to below 5.5. And that's the point where the enamel starts to dissolve. And here, the acid doesn't just go away immediately. It sits on your teeth for about 20 to 40 minutes after each sip. And if you're constantly sipping throughout the day, your mouth basically never gets a chance to recover. And that keeps your teeth under a constant acid attack. And for comparison, water has a neutral pH of about 7. And sparkling water is about 3.4, diet soda 3.2, orange juice can be 3.5, but kombucha, for example, can go down to as low as 2.5. And because the pH scale here is logarithmic, a small drop means a huge increase in acidity. And that's much more than what most people realize. But your saliva works constantly to repair early damage, and this process is slow. So if the acid exposure happens too often, your teeth basically never get a chance to recover. And over time, the enamel thins, it becomes more translucent, it increases in sensitivity, and that can lead to cavities and all sorts of problems. As we discussed earlier, at night, your saliva production naturally drops. And if you're exposing your teeth to acid in the evening, like wine with dinner, your mouth has less ability to neutralize it. And if you're also mouth breathing while you sleep, it dries out your mouth even further, and that ends up compounding the damage. And I'm not telling you to avoid acidic drinks completely, but the timing here matters. So have them with meals when the saliva flow is higher, rinse with water afterwards, chew sugar-free gum to boost saliva, and avoid brushing right after, and wait for at least 30 to 60 minutes to prevent scrubbing away the softened enamel when it's at that vulnerable state. And it's not just drinks that we're talking about. So citrus fruits, tomato-based foods, vinegar dressings, chewable vitamins, and even certain medications can be acidic. And sipping sports drinks and energy drinks, especially when you're dehydrated, can be even more damaging. And habit number 3 is nighttime clenching. So while you're awake, the average bite force you generate is about 70 pounds per square inch, or about 320 newtons. But when you're asleep, without conscious control, that force can spike up to 200 or 250 pounds, which is over 1,000 newtons. And that's enough pressure to crack a walnut. So these forces, repeated night after night, wear down your teeth that are already weakened by acid and dryness. And more than 80% of clenching and grinding happens during sleep. Most people have no idea they're doing it until the damage becomes obvious. And the problem here is growing. So, for example, in the last decade, rates of nighttime bruxism or grinding has basically increased by about 30%. And that's driven by factors like stress levels, rising stress levels, poor sleep, and lifestyle changes. Clenching isn't just about stress. So it could be a combination of factors. It could be elevated stress hormones, sleep disturbances, misaligned bites, and even certain medications, especially antidepressants, and even genetics. And the forces are triggered by your nervous system here. They're not triggered by your conscious mind. And the pressure from clenching here creates microscopic cracks in your enamel. And over time, these cracks can lead to chips, fractures, and eventually broken teeth. And it can also affect your gums. It can cause them to recede, and it puts strain also on your jaw joints, which we call TMJ or temporomandibular joints. And that can lead to jaw pain, headaches, and even bite changes. And today's lifestyle habits make it worse. Higher stress, more caffeine, poor sleep habits, constant screen exposure, and even common medications like SSRIs. All of these increase the clenching risk. And it's no surprise why many people nowadays have serious dental damage by the time they're in their 40s or their 50s. So how can you tell if it's actually happening? And signs of nighttime clenching include waking up with a sore jaw, or tension headaches, or increased sensitivity to cold, and teeth that might seem shorter or flatter than before. And you might also notice clicking in your jaw, or your bite might feel a bit off or different. And if you have a partner, ask them, because grinding sounds are often loud enough to even be heard during sleep. So what can you do about it? And the first step here is protection. So a custom fitted guard won't stop you from clenching, but what it will do is it will spread the pressure across your teeth, and it can reduce the damage. And I wouldn't recommend over-the-counter guards because they don't fit properly, and sometimes they can make the problem worse. But we need to address the root cause here. So long-term, you need to lower the clenching triggers. And this means managing stress, improving your sleep habits, and even making a few changes like cutting off caffeine in the afternoon and reducing screen time before bed. And even sleeping position here matters. So sleeping on your back with proper support can actually help you reduce the jaw tension compared to sleeping on your side or your stomach. And on their own, mouth breathing, acid exposure, and clenching can all cause damage. But when they happen together, they create the perfect storm that can accelerate tooth destruction.